Hello everyone. In this session, I would like to speak about menopause and the care women need to do during and around menopausal time. So, first of all, we need to understand what is menopause. Menopause is complete cessation of menstrual period in a reproductive age group women's life. In other words, it marks the reproductive period or reproductive phase in a woman's life. So, at what age one attains menopause? On an average, it's around 47 to 51 years of age, and for Indian women, the average age is 50. Sometimes, due to certain pathological or genetic factors, a woman can attain menopause at an early age, what is known as premature menopause. So, if the menstrual cycle stops before the age of 40 years, then it is known as premature menopause. With menopause, there is deficiency of female hormone, what is known as estrogen and progesterone. As a result, they present with various symptoms and signs. Some of the common symptoms are irregular bleeding or heavy bleeding or prolonged bleeding. Many women do complain of hot flashes, sudden gush of heat in the upper part of the body like neck, chest and face, associated with palpitation and sweating. Women do complain about a sense of tiredness, aches and pains, mainly in joints. Some women also have symptoms like lack of sleep, what is known as insomnia, irritation, mood swings, and difficulty in sleeping or anxiety. What are the physiological changes which we see in a woman's body? Mainly, there is a change in the genitourinary tract because of the changes in the epithelium and as a part of deficiency of estrogen. So the women do experience dryness in vagina, increased frequency of urinary tract infection, increased chances of incontinence and prolapse. There can be also skin changes due to the lack of elasticity and loss of collagen from the skin. Women do have wrinkles on their face and the skin. On a long-term basis, women do have equal chance of getting heart attacks after the age of menopause, and almost all women have certain bone loss or a decrease in bone mineral density and what is known as brittle bone disease or osteoporosis. So this thinning of bone also increases the risk of fractures. So even a trivial fall can have or cause fractures in women in menopausal age group. So how do we address menopause? Most of these symptoms can be managed by lifestyle changes, like including a good diet, following certain routine exercise like yoga or aerobic exercise, and also practicing sleep hygiene. Sleep hygiene is something very important for menopausal women because by practicing simple methods like sleeping on a regular time basis, not taking caffeine or alcohol before going to bed, all this will improve the quality of sleep. Besides this, maybe for a short period, hormone replacement therapy is also helpful to combat the symptoms. And few women also take a lot of supplements What I advise is what is required is calcium supplement around 1000 milligram of calcium, which can actually strengthen the brittle bones or the weakened bones. As a whole, 1/3 of women's life is in the menopausal period, and by taking care of this time, by living a holistic life and having a holistic approach, we can actually live a healthy life and a happy life.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.